The type of families we're seeing, they're experiencing difficulties with their toddler. It may be that the toddler's aggressive, or the toddler's not listening and non-compliant, or sometimes the toddler's a little bit withdrawn and the parents are concerned about the behaviour. I think parenting is very tiring. I think that's part of it, being extremely tired and perhaps not following through with things. The clinic is about nurturing the relationship between the parent and the child, so we try and enhance that, and the first part of the program is very much about the parent and the child playing together around play therapy and enjoying each other's company, with the mum using lots of positive praise, which in turn the child responds to, and often just by starting off that sort of, breaking that sort of negativity cycle, things improve. The play we do in the toddler clinic is a fairly structured play, and we actually are doing it at the table, and we're asking that the mothers let the child lead so that the child can play with whatever they like, and the mum gives a running commentary of the play and praising the child for all the good behaviour. And we have a technique where we ignore the negative behaviour. So obviously children do want to please the parents, so when they're getting lots of positive praise, they tend to increase that pro-social behaviour. I guess the mums that come to the clinic are pretty motivated to make change. They want to make a difference because they're finding the behaviour is quite challenging for them at home, and they're prepared to come to the clinic every week for up to 10 to 12 weeks. So they're wanting to make a difference, and they're take on the program with a lot of enthusiasm, which is great. When we do our assessment, we're looking at the holistic view of the whole family and how things are functioning, and sometimes realistically the program is not the only resource that these families need, so we do access other services like counselling, psychiatrists, speech pathologists and family support within, and sometimes they need to have residential stay for their children for sleep issues and that sort of thing. So it's a holistic look of things, of what's going on for the family and how we can best help those families. I'm pretty passionate about my job, and I get a lot of positive feedback. I mean, I love being able to see the progress these parents make, and just the increase in their confidence is enough to think, gee, we're really heading in the right direction. And a lot of it is for them to be confident and to follow through with things, that they get the results. So yeah, I get a lot of positive feedback. We do heaps of listening, yeah. A lot of it is about just reflecting on what the parents want. I mean, what they want to change. It's all about, finding their strengths and finding how that we can best work with those strengths to get the results that they want. Well, I guess a lot of parents don't always have the ideal circumstances when they first have their babies. Some families have had losses in their families, they've had a lot of financial grief, they've had issues with mental health issues, and it makes it very hard to enjoy your baby when you've got a lot of pressure with those sort of things happening. So I think we need to have an understanding that it doesn't automatically sort of happen, that it's about a growing process, and sometimes there are issues that come in that way. And often we'll see that when they have their subsequent children, they sort of recognise that things weren't quite right with the first child, with the relationship, and that's when they come to the toddler clinic wanting to change that and wanting to enjoy their toddler more. Well, the program is a two-phase program. So the first part being the parent-child relationship building, and we start off with the play, and we get the mother to actually play with the child and to listen to the child, and for the child to be leading. In that play segment, we find that sometimes that difficult behaviour does rise, so we have a few strategies that we put in place to cope with that. The child ultimately really wants to be playing there nicely with the child because they're getting lots of praise and that nice warm relationship's happening. So when we stop the play, if there's an aggressive incident, the child really doesn't like that. They really want to get back to the play. So if it's an annoying sort of behaviour like, repetitive noising or shouting or whatever, we would ignore. And then when the child stops doing that behaviour, we go back to the play. So it's kind of reinforcing the good behaviour and ignoring the negative behaviour. Also, we're getting the parents to reward when they're seeing nice positive praise, when they're seeing nice behaviour, when the child's being nice and gentle with the sibling. We get them to praise them for that, and that's sort of asking them to let them know exactly what we like about the behaviour. So we call that a label praise. I really like it when you play gently with the baby.
Good boy. You're driving him in the garage. Good boy.
See how he's really enjoying it.
Love it when you're gentle.
Good.
And playing on the table. That's excellent.
Good, Amanda. Excellent.
Oh, we don't eat the toys.
I like it when
Good
you play
boy.
with it.
I like it when we play with them on the table.
Ignore that. Ignore that.
So good boy. On the back, and you can drive him around.
Excellent.
Again. Evan's much happier. He responds a lot quicker when he's being naughty. When I tell him off, he responds a lot faster. Can you push him up?